Welcome to the very best of living with Dr. Promise. Today, we're looking into something that affects millions of older adults around the world: blood clots. I am still your favorite, Dr. Promise, promising you the very best of life. Before we start, please, if you are 60, 70, or 80 years, gather around me. Above all, if you are hypertensive, please don't be too far from me. Today I want to discuss the natural ways of combating this deadly blood clots that have killed many people. This has led to so many sudden preventable deaths. We all know that what we focus on in this channel is more of preventative medicine. And I always teach us to use natural means, which is the best for especially seniors from 65 years and above. Why? Because at this age, because of weakness and decrease in function of many organs of the body, you found out that conventional medicine in most cases will even make their sickness worse or even shut down already compromised organs like the kidneys and liver. But if we take the right step well ahead of time, by eating the fruits I'm going to teach us today, we can achieve longer, healthier lives. Before we go into the 15 healing fruits that can help preserve your heart and arteries, let me talk about my client that prompted me to make this video. I had a female patient who was 55 years old. Medically speaking, she was deemed overweight because her BMI ranged from 25 to 29.9 from the outset. We worked closely with her. We started her on the appropriate meds, provided her with appropriate counseling, and placed a strong emphasis on lifestyle modifications, increasing physical activity, eating better, losing weight. In addition, she had hypertension. Therefore, we made it apparent that she needed to take her prescription consistently, daily, because unchecked blood pressure can inflict quiet harm to the kidneys, the heart, and ultimately result in a stroke. Now, she was a stay-at-home mother of 3 children. She had a nanny assisting with household chores, which resulted in a fairly low activity level. Much of her day was dedicated to preparing meals for her husband and children. She occasionally smoked and frequently consumed alcohol. Naturally, we recommended that she reduce her intake, quit smoking, and adhere to her prescribed medications. We even directed her to a dietitian for additional guidance. However, during her subsequent appointment, she looked at me and said, "Doctor, I've made an effort. I've genuinely attempted to alter my lifestyle, but it's incredibly challenging." She mentioned that she was not fond of fruits and vegetables and favored her porridge, sauce, and desserts. Then she revealed something that surprised me. She mentioned that she had begun taking blood thinners on her own, believing it would help prevent stroke. She thought that medication alone would keep her safe. She overlooked the dietary recommendations. She didn't adhere to the necessary lifestyle changes. Even after receiving another referral to a nutritionist, she still chose not to act on it. We did all we could, provided encouragement, and checked in on her. But then, the next time we encountered her, it wasn't at the clinic. She was taken to the emergency room, gasping for breath, unresponsive, with her left side paralyzed, both her arm and her leg. It was a significant stroke, and unfortunately, she didn't survive. What am I trying to convey? Medication is crucial indeed, but it's not the sole solution. Pills cannot substitute for lifestyle. In fact, when we depend solely on pharmaceuticals and disregard our habits, we put additional strain on our liver, kidneys, and heart. That's why changing our lifestyle is not just a choice, it's crucial. We need to take charge right from the start, not when the harm has already occurred. The foods we consume, the ways we exercise, how we conduct our lives, these are important, and their significance increases as we grow older. So with that in mind, let's understand this blood clot a little. Now, this is the truth. Blood clots are not always bad. The fact is that when you have a cut on your body forms a clot to stop bleeding. That is a normal process, very healthy. So as we age, our blood circulation starts slowing down and the body's ability to regulate blood clotting becomes less efficient. So in hypertensive patients, it becomes even riskier because constantly elevated blood pressure causes tiny tears in the blood vessel linings. In a bid to repair these tears, the body form clots. But when this clots form in a wrong place or refuses to dissolve naturally, it can dislodge and block blood flow to some important organs. It could be in the brain, causing stroke, in the heart, causing heart attack, in the lungs, causing pulmonary embolism. In the legs, it can cause deep vein thrombosis, DVT, which can be life-threatening when it gets to our lungs. These are real risks, especially for older adults. Center for Disease Control, CDC, affirms that seniors over 65 years are at the highest risk for serious complications from blood clots. But I brought you good news. You are not helpless. That is why I am here today, bringing to you 15 choice fruits that can support your body's natural ability to prevent clots and help you live longer and quality lives. Nature has provided us some incredible fruits right in our kitchens, and today we're looking at 15 choice fruits. Yes, fruits that when you consume them, they can help naturally thin the blood, fight inflammation, and even help your body dissolve clots before they become a serious threat to our lives. These fruits are safe, delicious, and filled with healing components that support your heart and blood vessels, especially for older adults over 50. So grab a notebook and your chair. Just sit back and pay attention to what I am about to discuss, because the feeding habits you adopt today might just prevent heart attack tomorrow. So it is imperative you protect your heart. Let's dive in. It took me days to research these fruits, and I purposely worked towards getting a good number of them so that you have varieties to choose from. The 15 of them are all good, but some of them shouldn't be consumed in large quantities in the elderly. In this video, I also pointed out such fruits so that the seniors will eat them with caution. Again, you must not eat the 15 of them, depending on your environment. If you can lay hands on at least 3 to 5 of them, you are home and dry. The first fruit we are going to look at is the pomegranate. I chose to start with this fruit because it is as powerful as it is beautiful. When you crack one open, inside you will see the deep red seeds, bursting with juice and antioxidants. But I assure you, this fruit does more than just look good. It's rich in a component called punicolagens, which is a type of polyphenol that helps reduce inflammation in the body, clean up the arteries, and generally improve blood flow. More so, pomegranate can stop blood platelets from clumping together, which is the #1 step in clot formation. Taking a little quantity of pomegranate juice each day can lower your blood pressure, reduce plaque formation, and even help in preventing dangerous clots from forming. Just make sure you make it natural. Let it be pure juice. Please do not add sugar, or you can eat the seeds fresh like that without squeezing the juice out. Sprinkle them over some salads, or you can always blend them into a smoothie. It is delicious, sweet, tart, and good for your heart. #2 fruit is blueberries. So let us discuss about blueberries. They are tiny, blue, and packed with power. These little fruits are stuffed with anthocyanins. Anthocyanin is the compound that gives them their deep blue color and the supercharged antioxidant effect they possess. One of the properties of blueberries is that they help to reduce inflammation, protect the walls of the blood vessels, and prevent the blood platelets from sticking together. Put more succinctly, they help keep the blood moving smoothly and steadily. Now get the best part. They are also good for controlling blood sugar and also cholesterol, which makes them a true companion for older adults dealing with comorbidities, that is, multiple health issues. You can enjoy them by tossing a handful into your breakfast bowl, blending them into a smoothie, or just eat them as snack fresh. You can also frozen them too. It is equally good, just as powerful. 3 strawberries. They are juicy, sweet, and heart smart. Strawberries are not just a treat. They're medicine on their own, very rich in vitamin C. Vitamin C keeps our blood vessels strong and flexible. But here's the shocker. I'm sure you don't know about this one. Strawberries contain natural salicylates, the same blood-thinning compound found in aspirin. Salicylates can help prevent clots by preventing platelets from clumping together and gently thinning the blood without side effects. Some strawberries a day, maybe 4 or 5, can actually support circulation and protect your heart. Cut them over your breakfast. You can add them to yogurt or even eat them fresh as a snack. It's like a dessert with some healing benefits. The fourth fruit is raspberries. Where's berries? These are tiny, tasty, and surprisingly powerful fruits when it comes to protecting your blood. These little berries are loaded with vitamin C, fiber, and anthocyanins. These are natural compounds that help keep the blood vessels clear and your blood flowing with ease. But let me tell you what makes raspberries really special. They contain a compound called ellagic acid, a very strong antioxidant that fights inflammation and helps stop clots from forming in the first place. They're also great for regulation of your cholesterol levels, which means less plaque buildup and lower clot risk overall. Isn't that amazing? So let's look at how to enjoy them. You can eat a handful fresh. You can toss them in a bowl of oats or blend them into a smoothie. Your heart will love it and hug you, and so will your taste buds too. The fifth fruit is blackberries. Now let's talk about blackberries. I love this fruit, dark, juicy, and loaded with a lot of goodness. These lovely beauties are packed with flavonoids, the heart-loving compounds that help our arteries to relax and reduce the risk of dangerous clot formation. They are also a great source of vitamin K, which helps keep the blood clotting system balanced, making it not too thick, not too thin, just right. And here's a bonus point. They are rich in magnesium and potassium. These are two minerals that keep your heart beating strong, and they also keep your blood pressure in check. How do we enjoy them? You can eat them fresh on their own, or make them part of a fruit salad for a rich, tangy twist. Your circulation will definitely thank you. Number 6 is papaya. So we go tropical with papaya, yellow, sweet, soft, and surprisingly powerful for why? Our blood health. This fruit contains an enzyme called fibrin. Fibrin helps the body naturally breaking down blood clots before they become dangerous. Papaya is also packed with vitamin C, beta-carotene, and folate. All of them help to fight inflammation and also keep your blood vessels healthy and flexible. Another plus is that papaya is great for digestion because a healthy gut often means better circulation, especially in older adults and seniors. This is how to enjoy your papaya. You can eat it fresh or add a squeeze of lime or blend it into a smooth tropical drink. It's really delicious, and your body will love the beneficial effects. 7. Cherries, lovely, bright, red, and loaded with powerful benefits. Cherries are not just delicious, they are also packed with natural salicylates, the same compound found in aspirin. Salicylates helps thin the blood and prevent clots from forming. A study from the American Journal of Clinical Nutrition publication revealed that tart cherries contain compounds that reduce inflammation and oxidative stress. Both of these compounds contribute to clot formation and cardiovascular disease. But you have not heard it all. Cherries are also rich in anthocyanins. This is the antioxidants that reduce inflammation to protect your blood vessels from damage. Let me tell you something extra special. Cherries are a great source of melatonin. Melatonin not only helps you sleep but also improves circulation. Make them part of your morning smoothie. Add them into a fruit salad or just eat them fresh. Your heart will be grateful. 8. Figs. Figs are small, sweet, and full of fiber. They are fruit you might not think of often, but they're loaded with nutrients that help keep your blood healthy. They contain a mix of antioxidants, fiber, and potassium, which help to regulate your blood pressure and keep your blood vessels clear and flexible. A publication in the Journal of Nutritional Biochemistry found that figs are rich in polyphenolic compounds that exhibit anti-inflammatory and antioxidant properties, which helps to prevent oxidative damage to blood vessels and also support healthy circulation. Also, they contain omega-3 fatty acids, a great addition for heart health, and they also support healthy digestion, which can, in turn, benefit circulation, whether you consume them fresh or dried. Add them to your oatmeal, smoothies, or desserts. Figs are a very simple way to support healthy blood flow on a daily basis. Number 9 fruit is kiwi, small, fuzzy, and mighty. Kiwi is one of the most underestimated fruits when it comes to blood health. It's packed with vitamin C, vitamin E, and also potassium. It also has strong anti-platelet effects. That is to say, it helps stop clots before they even start forming. A publication in the American Journal of Clinical Nutrition shows that eating at least 2 kiwis a day can reduce platelet aggregation, meaning that they help to stop platelets from clumping together and forming clots. This has been found to lower the risk of heart disease and also stroke, but some studies reveal that eating 2 kiwis a day can reduce clot risk. While they also lower triglycerides and blood pressure, kiwis are sweet, tangy, and refreshing. You can eat it on its own, slice it into fruit salads, or extract it right out of the skin with a spoon. They may be small, but its impact is anything but small. 10. Plum. They are sweet, juicy, and packed with heart-healthy benefits. Plums contain a good number of antioxidants, especially flavonoids and phenolic compounds. These have been shown to protect against blood clot formation and also reduce inflammation. A scientific publication in the Journal of Nutritional Biochemistry revealed that plum extract helped reduce platelet aggregation, making it more difficult for platelets to clump together and form life-threatening to blood clots. Plums contain vitamin K, which plays an important role in maintaining proper blood clotting, but without increasing clot risk. Another key benefit is their high fiber content, which acts by helping to lower cholesterol levels and reducing the accumulation of plaque in your arteries. Enjoy your plums by eating them fresh, blending them into smoothies, or processing them dried for a quick heart-healthy snack. The 11th fruit is lemons. Lemons are citrusy, tangy, and loaded with heart health benefits. Lemons are loaded with vitamin C, a very important nutrient for collagen production in your blood vessels. This works by helping to keep your blood vessels stronger, flexible, making it difficult for clots to form in the first place. A scientific study shows that vitamin C can also help lower blood pressure, which is a key factor in clot formation, thereby improving the overall circulation. That is not all. Lemon contains flavonoids like hesperidine and diasmin. These have been shown to improve blood vessel health, reduce inflammation, and also prevent blood clot formation. In one publication in the Journal of Clinical Biochemistry and Nutrition, lemon extract was found to improve blood flow by reducing oxidative stress, hence lowering the risk of clot formation. In older adults, you can squeeze fresh lemon juice into your water. You can add it to salads, or even enjoy a simple glass of lemon tea. It's always refreshing, tasty, and a trusted natural way to support your heart health. Number 12 is cranberries. They are tiny, tart, and powerful. Generally, they are well known for urinary tract health, but they also carry important benefits for your blood and heart. Cranberries are rich in polyphenols, especially proanthocyanidins, which help in reducing oxidative stress, inflammation, and even stop platelets from sticking together, a vital step in preventing clots. A scientific study in the Journal of Nutrition revealed that cranberry extract significantly reduced markers of cardiovascular risk. They do this by improving vascular function and reducing blood pressure, and this will shock you. Cranberries also help to improve cholesterol levels, lowering low-density lipoproteins (LDL) and increasing high-density lipoprotein (HDL), which protects your arteries over time. They are very good and commonly used for juice, but make sure it's unsweetened. You can add dried cranberries to oatmeal, salads, or trail mix. Cranberries are small fruits, but big protection. 13. Avocado. They are creamy, green, and incredibly good for the heart. Avocado is technically a fruit, and one of the best when it comes to supporting healthy blood flow in the vessels. Avocados are packed with monounsaturated fats, the type that lower bad cholesterol and support overall cardiovascular health. They are also rich in vitamin K, which helps the blood to clot normally without over-clotting. They contain potassium, which helps lower blood pressure. A scientific study published in the Journal of the American Heart Association refuted that eating 1 avocado per day significantly improved heart markers and reduced inflammation in the arteries. How do we eat avocados? 1. You can spread them on toast. You can add them to salads, or even eat them plain with a pinch of salt and lemon. Avocados are not just trendy, they are smart, heart-healthy choice for older adults. So let's look at the 14th fruit. Passion fruit is exotic, seedy, and surprisingly powerful. Passion fruit may be small, but it's packed with nutrients that help support healthy blood flow. It contains vitamin C in high levels, also contains fiber, and plant sterols. All of these work together to reduce inflammation, support artery health, and lower blood pressure. Passion fruit is unique because it contains phyciotanol, a compound similar to resveratrol that is found in red grapes. Studies have shown that this can act on two important factors in preventing blood clots and maintaining good circulation in older adults, and these are improving insulin sensitivity and reducing vascular stiffness. Passion fruit is also rich in soluble fiber, which helps regulate cholesterol and prevents the accumulation of plaque in the arteries. You can scoop it right from the shell, or you can blend it into juices. You can also mix it with other fruits for a zesty, smart combination. Passion fruit is more of a tropical fruit, but its benefits are universally documented. The last fruit is guava. Guava is fragrant, tropical, and nutritionally wonderful. Guava is very rich in vitamin C, even more than oranges, and that's a very big deal when it comes to strengthening blood vessels and backing healthy circulation. But that's not all. Guava contains high levels of potassium and fiber, both of which help to regulate blood pressure and lower cholesterol, thereby reducing the chances of clot formation in the vessels. A scientific study in the Journal of Human Hypertension showed that eating ripe guava daily led to significant drops in blood pressure and also improved lipid profiles, which support clot-free blood flow. How to enjoy guava? One can eat it raw, can blend it into juice, or even sprinkle a little chili and lime for a tasty snack that protects the heart. Now, besides selecting the right fruits, which we have discussed in detail, I promised us a bonus lifestyle habits that will perfect our goal. So let's go. There are several other crucial lifestyle habits we need to discuss. These habits can assist you in naturally preventing blood clots, especially if you're in your 60s, 70s, and 80s. Let's go through them one by one in a relaxed manner. 1. Stay active. Don't remain seated for too long, please. My seniors, attempt to avoid sitting still for extended periods. Whether you're watching television, attending church, or traveling, every hour or two, stand up, stretch your legs a bit, or take a brief walk. Why? Because sitting for long durations can cause blood to pool and clot, particularly in the legs. 2. Hydrate yourself. This advice is straightforward yet powerful. Drink water. Your blood requires hydration to flow properly. When you're dehydrated, your blood thickens, and thick blood can lead to clots. So even if you're not feeling thirsty, sip on water throughout the day, of course. Follow your doctor's guidance if they suggest otherwise. 3. Be mindful of your weight. Slowly and steadily. I'm not suggesting you go on a strict diet, no, just be conscious of your weight. Carrying excess weight puts strain on your veins and slows circulation. Try to incorporate more natural foods into your diet, limit processed foods, and increase your activity. Small changes can lead to significant results. 4. Opt for comfortable attire. You may not realize it, but tight, fitting clothing, especially around your waist or legs, can hinder blood flow. So while you want to look good and stylish, ensure your clothing isn't constricting your body too much. 5. Please refrain from smoking and reduce alcohol consumption. Smoking is a significant threat to your blood vessels. If you're still smoking at your age, please plan to quit. You are never too old to stop and reap the rewards. Regarding alcohol, a little here and there might not be harmful, but excessive drinking disrupts your body's clotting mechanism. 6. When lying down, elevate your legs slightly. You can place your legs on a pillow or keep them slightly elevated above your heart. This helps your veins return blood to the heart more easily and maintains good circulation. 7. Manage your health conditions. If you struggle with high blood pressure, diabetes, or high cholesterol, please take it seriously. Stick to your treatment plan and don't skip medications. These conditions can harm your blood vessels and heighten your risk of clots. 8. Compression stockings, if your healthcare professional suggests them. Some of you may already be using these. These specialized stockings enhance blood flow in the legs, particularly if you sit or stand for long periods. However, always consult your doctor before using them. 9. Gentle exercises can work wonders. There's no need to sign up at a gym. Simple activities like walking around your home, doing leg lifts from a seated position, or rotating your ankles in circles all help to pump blood and lower the risk of clots. Just aim to do a little every day. 10. Regular check-ins with your doctor. My friends, don't wait until you feel unwell. Regularly check in with your healthcare provider. Early identification of any issues can prevent a lot of stress later on. Let me emphasize, my dear seniors, that prevention truly outweighs and is less costly than treatment. By incorporating these straightforward habits into your routine, you're already making strides in the battle against blood clots. Now, as I previously stated, even though these fruits are strong and organic, some of them still need to be handled carefully, particularly by elderly people or those using specific drugs. Thus, before you dash to fill your refrigerator, let me briefly list certain fruits that, depending on your health, may need to be consumed in moderation or as advised by a physician. 1. Pomegranate. Warning: may interfere with medications that control cholesterol and blood pressure. If you are taking medication, speak with your doctor. 2. Kiwi. Warning: may cause a minor thinning of the blood. Limit your consumption and keep an eye out for bruises if you're currently taking aspirin or anticoagulants. 3. Papaya. Warning: when taken with blood thinners, the papain enzyme may raise the risk of bleeding. Take it in moderation. 4. Lemon. Caution: very acidic, may be uncomfortable for elderly people who have sensitive stomachs or acid reflux. 5. Avocados. Caution: avocados are high in fat and calories. Yes, it is healthy fat, but portion control is crucial, particularly for heart and weight health. As we conclude this enlightening video, let's pause for a moment of reflection. We have delved into 15 amazing fruits that are not only delicious, they're powerful partners in enhancing your health. These fruits are loaded with vitamins, antioxidants, fiber, and enzymes that help maintain a clean, balanced body and shield it from a significant and often unnoticed danger: blood clots. Blood clots can happen unexpectedly. They may result in heart attacks, strokes, deep vein thrombosis, and other serious complications, particularly affecting older individuals. However, the encouraging news is that your body has remarkable natural defenses. A highly effective way to bolster those defenses is by consuming real, wholesome foods. Each fruit we discussed, be it the fiber-rich ones, the antioxidant-packed berries, or the circulation-enhancing pomegranate, plays a distinct role in ensuring your arteries remain clear, your blood circulates smoothly, and your heart remains strong. Yet, mere knowledge won't suffice. What truly counts is how you apply this knowledge. Are you ready to take further action? Will you implement small changes today that could lead to significant health improvements in the future? We understand that life can be hectic. It is tempting to opt for whatever is quick, convenient, or familiar. But I challenge you today, not to change everything at once, but to begin with just one fruit, just one. Incorporate it into your breakfast, blend it into a smoothie, dice it into your salad. Make it a staple in your routine. Over time, that single fruit transforms into a habit. That habit evolves into a lifestyle, and that lifestyle shapes your health narrative, a narrative centered on prevention, healing, and vitality. For those of you in your 60s, 70s, or even 80s, you may feel it's too late, that the damage is irreversible, that your best health moments are behind you. But I want to reassure you, your body still has the ability to heal, your blood circulation can improve, your arteries can still be responsive. Even in later years, your body is capable of change if you provide it with the right resources. And these fruits, they are part of your toolkit. They are nature's gifts, freely given, with no side effects or prescriptions needed. Just wisdom, awareness, and intention. Of course, as we discussed earlier, moderation is still crucial. Fruits like kiwi and papaya contain natural substances that might interact with medications. Citrus fruits such as lemon may affect those with sensitive stomachs. Although avocados are heart-healthy, they are calorie-dense, so always pay attention to your body and consult your healthcare provider if you're considering significant dietary changes. But please, don't allow fear to hinder you. Use knowledge to empower you, because prevention isn't about achieving perfection. It's about being deliberate. It involves making small, consistent choices in favor of your future. It's about embracing life through your food choices, in your kitchen, and in your mindset. And remember, you're not on this path by yourself. At the very best of Living Health 001, we're dedicated to supporting you every step of the way. We aim to provide life-changing information grounded in science and motivated by compassion, to be a source of truth, support, and healing in a world overwhelmed by confusion and fear. So if today's video resonated with you, don't keep it to yourself. Share it with your family, friends, and neighbors. Leave us a comment. Tell us which fruit you're introducing to your diet this week. And most importantly, subscribe and enable notifications so you won't miss any tips that could transform or even save your life. In Dr. Promise, forever committed to delivering the very best of life. Until next time, stay strong, stay healthy, and stay blessed.